Families that choose to vaccinate should be able to, and families that choose not to should also be able to exercise that choice.
In California, there is absolutely no exemption.
One of only 3 states, the 47 states in the nation, provide exemptions.
Our case is going to the Ninth Circuit, Royce versus Pan. And when I talk about this case in other states, they're shocked to hear what California law requires and does not allow.
You just cannot force these things on people, because where there is a risk, there must be a choice.
It's wonderful to be with you. Perhaps you could introduce yourself for our audience.
Well, sure. I'm Dr. Donahoe. I've owned and run Donahoe Chiropractic in Murrieta since 1999. Our practice has been blessed to be able to serve thousands of families in the Temecula Valley since then. And my specialty has always been pediatric and prenatal care. So the work that I do is always centered around families and the care that especially that pediatric and prenatal population require and deserve. So I've always had a special passion for that. And of course, the subject of vaccines plays a significant role in the lives of the little ones that I serve. So it's always been something that we spend time educating on in the office. And it's something that my patients, especially of the little tiny ones, have lots of questions about. So it's something that we've been educating ourselves and our families on for decades now. Very, very important subject to these families.
Yes, it's a very important subject. And I think it's wonderful that we're talking today. And I know that you're a great friend of Advocates for Faith and Freedom.
Yes, ma'am.
Our case is going to the Ninth Circuit, Royce versus Pan. And it has to do with something that's so important in California. And when I talk about this case in other states, they're shocked to hear what California law requires and does not allow. And so in California, there is absolutely no exemption for religious beliefs.
Correct.
And there is an exemption for medical purposes, but it's very narrow, right? Perhaps you could tell us a little bit about that.
Well, the restrictions are narrow, but they're also the most challenging aspect of it is that in the state of California, although chiropractors are deemed essentially primary care at the same level as those types of practitioners, only doctors of medicine, medical doctors, and doctors of osteopathy, DOs, can write these letters. So exemptions can only be written by medical doctors or doctors of osteopathy. And they have to, the biggest challenge I was about to say is that they can only write 5 annually. That's the biggest challenge, not necessarily that they're restricted by diagnosis, because there are plenty of justifiable diagnoses. The challenge is that these doctors are restricted to writing no more than 5. Now, that doesn't matter whether their practice sees 5 patients annually or 50,000 patients annually. You only get to write 5 exemptions. So it puts them in a very tight spot where they either don't write them at all for fear of examination by the state boards, or they limit themselves to only those most significant cases. And so most of the patients that need or want these exemptions just don't have access to them at all, period. So with the absence of philosophical and religious exemptions and the inability to get a medical exemption, it leaves families with no other choice except according to the state to homeschool their children. And although I support that entirely and was a homeschooling family raising some of my children, not every family can do it. And so it's just not right to leave them with no other choice except to succumb to mandated state medical procedures. We should have learned a few years ago that it's time to put an end to all mandated medical procedures. And yet we're still doing this in California, one of only 3 states. And that's why these others are so shocked that we still require this. The 47 states in the nation provide exemption. So, the reality of the situation is that we cannot protect the children. If the goal was to protect children from communicable diseases, and every other state in the nation does it, and we're visiting with friends and family from every other state in the nation all the time, how are we supposed to protect these little tiny classrooms of children and keep them sterile? It's just nonsense, really. So the whole thing needs to come to an end, and families that choose to vaccinate should be able to, and families that choose not to should also be able to exercise that choice. Whether it's religious or simply philosophical, there should just simply be no mandates, period. This is religious and medical freedom that we're talking about.
When you compare the rates of communicable disease amongst school children or maybe even the greater population. Is there a difference between these states that disallow any sort of religious exemption?
That's
And
a very good question. From a statistical standpoint, I guess I haven't answered that, but I would assume you wouldn't see any any difference whatsoever. If there were, it would be negligible. The reality is the system doesn't work. We know that vaccines may confer some degree of short-lived artificial immunity, but we also know for sure that children that have been fully vaccinated will succumb to the same disease that they were vaccinated for, and that happens in any number of cases with every vaccine that's available. So the reality is the system cannot work the way it was originally intended, and therefore nobody should be mandated to take part.
that's really interesting. Have you studied that area where children have been vaccinated and then they get that exact disease?
Oh, of course, we see that all the time. I mean, the problem that brought us to this position in California was the measles outbreak that took place in Disneyland 13 years or so ago. And, it was because measles, everybody had the measles. But what they didn't report in the statistics that they shared, of course, all of the blame went to the unvaccinated patients that then had measles. Half of those cases that occurred in Disneyland were fully vaccinated individuals. So it's very easy to lay the blame on those that were not vaccinated. But the reality is those that were fully vaccinated or partially vaccinated still came down with the disease and shared it with others exactly the same way as we learned with COVID. So the problem is that these vaccines can never confer full immunity nor protect individuals from transmitting the diseases. So why do we put 100% faith and trust that they will? It's nonsense.
I think it's interesting too with the measles epidemic that started in Disneyland. So that was during the school break, right? It was in
I
December
believe it was a winter break, yeah.
during winter break. So it started not in the schools, right? And
Correct.
Disneyland, there are no vaccine requirements to this day, right? To visit
Correct.
Disneyland. So the place where the transmission occurred is unregulated, but yet now there's more regulation in the schools. How does that work?
It just doesn't, right? That's what we're discussing is the fact that it cannot work because these children are not kept in these little tiny incubators. They leave that space and go other places, whether it's visiting friends and family out of state or someplace like Disneyland. There's no way to keep them in this sterile space. It just isn't possible. So the problem again relies or falls on this, where we would trust the vaccine to do its job, 100% safe, 100% effective, and it just is not the reality. And so if we could say, hey, it's safe, it's effective, it works, these kids are never going to come in contact in any other place with these contagions, then perhaps this system would work. But on its face, it cannot. There is just so many flaws built into it. So we put this artificial faith in this artificial system of immunity, and it just falls flat in every facet of how it's supposed to work. It cannot work. But then we're breaking free of this religious paradigm, this medical religious paradigm, where we simply believe in medicine to the point where if you get the shot, you won't get sick and you can't give it to others. If you believe that, then you believe that. But sadly, the statistics will show that that's not the case, and the system cannot work the way it was intended to.
I know a lot of people talk about how many vaccines are required presently as opposed to how many were required, 30 years ago. Could you explain what the California requires now for regulation to stay in either their private schools?
Well, many of the families that we work with, when they're on the border or on the fence of what are we going to do, well, the most common argument is, well, I got my shots and I'm fine. Okay, I understand. What year were you born? Well, I was born in 92. Okay, in 92, we had 1/3 of the number of shots that are now recommended for your child. So that schedule has tripled since you got your shots. So if we took an individual who was susceptible to something at that point in time, we probably saw fewer that were exploited because they weren't being as heavily burdened. Well, now we triple the burden, and that's why we see so much more exploitation of that weakness. This is why autism numbers have continued to skyrocket, along with other neurological injuries, asthma, autism, allergies, ear infections, eczema, you name it. These numbers have gone up and up and up in the last 15 years, or excuse me, 30 years now, since 93, since we've mandated this triple vaccine schedule. Now, the additional newest changes at the federal level, the 17 shots that were being requested or recommended for your child from the CDC recently changed. This was about 4 weeks ago. The CDC said, we're going to make some changes. They reviewed the vaccine schedule. They came into alignment with other industrialized nations, and they reduced the number of 17 shots down to 11. Well, that's well and good. I think we're moving in the right direction. Thank you for making those changes. Remove some very important, unnecessary, and even risky shots from the schedule. However, the state of California keeps one of those shots that the federal government says you don't need on the schedule for school attendance for these children in California. That's the hepatitis B shot. And it just doesn't make sense when California says, well, you have to have it or you can't go to school. And the federal government says, you don't need that shot at all. So it puts parents in a really tough spot when they're hearing from the federal government and the state government two opposing things. And of course, as ought to be the case, the federal law should be overriding state law in virtually every aspect of how we apply law. And so the federal government says you don't need that. The state says you need that. Parents are like, well, I don't want that. Now what do I do? You know?
Yes. Could you tell us more about the hepatitis B shot and what it prevents and how that disease, is passed from one person to the next?
Well, hepatitis B is obviously a blood-borne contagion. It's shared through blood sharing, bodily fluid sharing, IV needles. There's different ways that that's transmitted, but they require that type of intimate contact. Now, hepatitis B had been recommended for newborn infants as simply a matter of course because of the concern that mom might be a carrier. Well, we look at the numbers. Moms that carry hepatitis are a very, very small number. So then the risk became, well, what if that child has an injury while they are in the hospital where this disease might be more prevalent? And so the concern became, well, what if a child experiences a needle stick in the hospital? And parents look at me and go, well, my kid shouldn't be receiving a needle stick inadvertently in the hospital, now should they? And I go, I agree with you. So the risk of hepatitis B was extremely low, yet the mandated procedure was that every child be treated as high risk, and it just didn't make sense. So that's why the federal government said, hey, this is just not a high enough risk issue. We're not going to push forward with mandatory vaccination of hepatitis B any longer. And it made sense. I mean, it makes crystal clear sense. It is simply not a disease that our infants are particularly prone to coming down with. And so why would we burden them with a risky procedure that is definitely invasive? We have to break the skin. These things always come with some degree of risk. Why would we do that for such a low incidence of concern with hepatitis? So this is why the changes, yet the state of California is refusing to address it. In fact, shortly after the federal government made their changes, the state of California said, we are going to, in fact, stop listening to the federal government when it comes to vaccine recommendations, and we're going to start making our own. I believe, in fact, they said, we're going to follow the World Health Organization's recommendations after the federal government also left the World Health Organization. So California is very much on their own path, thanks to our wonderful governor, Gavin Newsom, at this moment. We're on the wrong path, but we are charting our own course forward, which I don't think is going to end well for California. And that's your job to help me make sure it happens, Aaron, is to make sure that California does not chart this path forward and instead falls in line with the rest of the 47 states that know what they're doing here.
Did you ever think that California would depart from CDC recommendations?
I never would have imagined. No, I didn't. I mean, that was definitely a curveball. But I have imagined and dreamt for 30 years that we would get to this point where vaccines would be removed from any type of mandatory schedule, and we're that close. And in fact, after we get to that point, which we're just over that hurdle here shortly, I'm sure that 10 years from now we'll be looking back on the number of children that were sadly injured as a result of vaccines, and we will recognize the error of our ways. Think about medicine 130 years ago, using leeches and bloodletting and drilling holes into people's skulls to let evil spirits out. this was medicine at the time. It was respected medicine at the time. I'm pretty sure that 15 years, maybe 20 years down the road, we're going to be looking back at this vaccine schedule and going, oh my gosh, we made mistakes. And hopefully we've learned from our ways. And the goal really needs to become to embrace what we refer to as naturally acquired immunity. That's where the God-given gift of long-term health comes from. We are supposed to get sick as children. We're supposed to prime our immune system with various in pathogenic organisms, whether they be viruses or bacteria, mold or fungal. These things are supposed to stimulate responses in our immune system. There's just no way to live in a sterile world. It's not the world that we live in. And when we embrace naturally acquired immunity and the gift that it gives, which is in many cases lifelong immunity, we'll be able to look back at these vaccines and go, what were we thinking? We need to invest in naturally acquired immunity, which is just letting our kids get sick, but fortifying them, strengthening them, and helping them through that vital crisis so that they get out on the other end safely. One of the things that I should say right now is that the families that I serve have to learn how to doctor their sick patients. And the first thing I have to tell them is don't be afraid of the fever. You understand, when we have a sick child and we immediately put them on a Tylenol or something to bring down that fever, we're going to prolong and potentially deepen the infection. We need to let that fever do what God told the body to have a fever to do, which is suppress that viral and bacterial replication rate to activate components of our immune system that are only active in that fever state. If we learn how to manage a fever the right way, we can actually facilitate our children getting healthier quicker. We get them through that process better, faster, stronger. So it all begins in these first few moments. We have to learn how to manage illness. And that's not to be afraid of it, but rather to learn how to manage it. And that is embrace the fever and then do other things, natural antimicrobials, immune system supporters, symptom mitigators in the form of homeopathic remedies. When we do those things, we can get our children through the crisis that we know they have to get through, but we can do it with much more confidence that they'll come through it, not only safely, but stronger on the other end. So everything begins with this underlying philosophy of how do we manage illness in the body, right? Is it to be afraid of and to be constantly afraid that it's going to snatch our child in the middle of the night? Or is it something that we need to say, okay, here's the enemy. Let's have a plan of attack. Let's do this, that, and the other, and we'll get it under control. And the children that I serve, that's the course that we take all the time. And these kids get well in 3, 4, 5 days versus 7 to 10 days because the infection has been driven deeper into the body. Sadly, these medical doctors that talk to families about, well, you're going to see this infection become meningitis. Yes, it can become meningitis, but how does it become meningitis? It's driven deeper into the body through the suppression of the natural instincts of recovery. So you fight that fever, you push the infection deeper into the body. That ear infection can become meningitis. In 30 years almost of practice, I have never seen one fever become meningitis. Why is that? Because we teach our families to manage them the right way. But medical doctors might say, well, we see that all the time. Well, why do you see that all the time? Because you invited that to happen. So, we have to just have a shift in thinking. We have to teach families not to be afraid of illnesses, but learn how to have the confidence to manage and overcome them. And that takes work as well. So we're doing education constantly on how to raise these kids and avoid these shots and pour into them what they need to get out of life. And that is the ability to express their innate potential. That's what we're looking for.
Why do you think it is that your methodology has not reached the forefront, but yet very loud voices advocating for California's schedule, for instance, with vaccination have?
The simplest answer is money, Aaron. It's all money driven. When we have healthy patients, they don't come to the doctor. When we have sick patients, they spend a lot of time and money in that physician's office. And that is the ultimate reality of the situation, is that we're talking about healthcare as a business. Boom.
It's really interesting with the case that we have before the Ninth Circuit, the Royce case challenging SB 277, going through the legislative history. And just, it's almost like a palpable disdain for
Yes.
who have religious objections to vaccination, and that their religious objection is harmful. What are your thoughts on that and that kind of, I guess, attitude? toward.
Well, I think that that attitude comes from this concept of you need to get this shot so that I don't get sick. And that simply, it doesn't work. I mean, we can argue that for hours, but ultimately you're going to go in circles. Um, we know from experience of COVID that the vaccine is not going to keep one from transmitting the disease. And that's the underlying issue. You cannot insist that somebody else undergo a medical procedure so that you feel safer somehow. You may feel that because somebody jumped through the hoop for you, but the reality is that jumping through that hoop conferred no protection for you. And until you grasp that, you're going to operate from a place of fear. And that place of fear drives this whole you have to do it so that I feel safe mechanism. You see, they just keep going in circles. They just don't grasp the reality of I cannot be protected. You cannot be safe just because I get this procedure. And underlying all of that is the philosophy of I don't need to do anything for you. I'm sorry, but me and my family have a different course, and you have no say over my life or the choices that I make for me and my family. I'm sorry how you feel, but everybody is entitled to autonomy. Nobody gets to control other people out of their own fear.
My body, my choice, or
It's kind of simple, right? I mean, it's been said numerous times, but it seems to go in one ear and out the other when it doesn't suit their purpose, right?
Well, it's interesting that people who believe so strongly in that sometimes will have conflicting beliefs when it comes to this issue,
Yeah. And if you say, can you please explain that concept? It's all of a sudden, boop, shut down. We don't talk about that. It doesn't make sense. Computer. Yes.
Yeah, it's really interesting. So,
Yes.
have you followed the case at all, Miller versus McDonald? It went to the Supreme Court. It's out of New York. So it's,
I know that there is another case. Yeah, I haven't been seeing what's going on with it recently.
yes. So it stems from the Amish community.
Mm-hmm.
An Amish school that New York, who also has a law like California's where there are no religious exemptions, um, they had a school that New York fined for not being in line with New York's vaccine policy. So it's kind of well, not kind of, it is a very isolated Amish community.
Mm-hmm.
And the case went all the way up to the Supreme Court to see whether or not these fines should be allowed against the Amish for not following the vaccine policy in New York. And I think it was very difficult to try to justify these laws must be followed when it is a really secluded community. And I mean, I think that when we're looking at these religions and it's a minority religion and they keep to themselves, the Amish community, a very simple community. I think it was very difficult for the Supreme Court to simply deny them relief and let them be fined, over $100,000 by New York State. And so they actually decided in favor of the Amish community. And so they vacated the unfavorable decision out of the Second Circuit and said, okay, what we want you to do is apply the First Amendment in a more broad way, applying another case that the Supreme Court decided, which seems to be just a huge monumental step in how these cases are analyzed. Because
that would be
until now, it's been, we don't talk about this. This is, not an area that the Supreme Court would really want to, test the waters of, but it seemed like they couldn't deny that case. And so now when we have these cases that are coming, in the so our oral argument in Royce is on the 17th of April, and we could find out the result of that, a few months after or earlier. But regardless of what happens, it will most likely be appealed then to the Supreme Court. So it seems like for the first time that there's actually the potential of the court hearing a case like this, which is really interesting.
Gosh, yes.
It's something that, I wouldn't have thought that we would have gotten here this quickly. I guess, how much do you think everything that the country went through with COVID has kind of changed how people view these sorts of cases and these objections.
Oh, I know it's been a significant change. Yeah. Obviously, as I said, I've been doing this family care for years and years. And prior to COVID, even in my practice, where we might have alternative minded families who are, bucking the system and doing it in a different manner, roughly, I would say 80% of the families that I serve were just doing, as a matter of routine course, the childhood vaccine schedule. 20% or so of families that I interviewed would say, oh, no, we don't plan to, or we're part of we need to learn a lot more before we decide what we want to do group. But since COVID, everybody has had their eyes open. And I've got to tell you, Aaron, that those numbers have completely flip flopped. I now see 80% of families who tell me we're not doing it, or we are definitely going to do it differently than they recommend, or we're not sure what we want to do and we have some educating that we need to accomplish. Can you help us out? There's only a small number of families where I sit down that have checked that box that says we are vaccinating according to schedule. It's a rarity in my office now. So I believe that parents have really had their eyes opened, and the vaccine issue, the safety, the effectiveness has definitely come under more scrutiny. And since then, we've had publication of some amazing articles, some interesting research, what I call the comparison studies, where we take a group of children over here that has had some or all of their vaccines and a group of children over here who's had none, and we compare their healthcare needs and the outcomes of those needs over time. We get a very good and clear picture of what those needs are and what those outcomes are. And we've been watching these kids not for 6 months, not for 2 years, but for 10 full years of life. And when we do a retrospective analysis of what these kids' lives have been like for 10 years, there's a dramatic difference. And this group over here that's had no shot seems to be healthier, stronger, more vibrant, fewer problems, whether we're talking about that autism spectrum disorder and other neurological injuries like ADD, ADHD, Tourette syndrome, but also the other stuff that we're talking about, like the frequency of ear infections, anemia, asthma, eczema, just the things that many, many children deal with. There's more incidence of those problems in this group than there is this group. And we have that data now. And so parents have seen the firsthand experience of COVID, and now they have some interesting studies that they can read. And when they step back, they go, why is anybody doing this, is what they ultimately say once they've had a peek at the research. And I think that that's the sad reality, is that these families are never given this information. In the state of California, anyway, the pediatrician, and sadly, it's by the state of California, has had their hands handcuffed. The conversation that they're allowed to have is basically, here's the brochure that explains what you should do with the shots. And so, what's interesting is that it used to be, here's the CDC brochure, and the CDC made some changes to that brochure. And so now I'm not even sure what they're supposed to be handing out, because California is bucking what the CDC is saying. But the conversation is not what we would consider to be informed consent. They're just never given all of the statistical information that they really should be given, so that the parent can say, this is a choice that I'm making. It simply is fear mongering, the pressure, in many cases, humiliation. I've had many tactics employed with parents where they're even threatened with CPS intervention. And of course, CPS has nothing to do with this. You can certainly choose to not vaccinate your family or your children, but they use these types of strategies, and these poor families just feel like they're being strong-armed. And the reality is you should be given informed consent and given a choice. The underlying theme is this, that where there is a risk, there must be a choice. It's that simple. It's these words. Where there is a risk, there must be a choice. But the medical system is denying that there's a risk. And so we end up with you don't get a choice. And that just doesn't work for the people who have had their eyes open to this stuff.
If we could unpack that. So when you say that CPS are called on parents, who is making that complaint? How is that happening?
Well, usually it's the doctor in the office that's handling or managing the case, whether it's a brand newborn who they're recommending shots for, or it's at a 2-month appointment and the pediatrician is setting the stage for the future shots to come. I've heard too many of these incidences, and they may not have the phone call made, but they will infer that they may make it if the parents don't comply. And I think that is just terrible. I mean, nobody should ever be threatened especially with intervention by the state into their family, unless we have an extremely valid reason. And I've seen too many times that families have had their lives disturbed by these types of interventions over a subject as it should be open and shut as these vaccines. It simply isn't a mandated procedure. Everybody gets to make their choice. The result is that, well, you don't get to go to school, but you still get to make that choice. There's no mandatory procedures, period.
But not getting to go to school, that's a pretty big
Of
ramification.
course. Yeah. I mean, for many families, that's huge, of course. Yeah.
Parents then have to homeschool. I mean, it's really amazing that private, public, all the schools are regulated where there aren't these exemptions. But when you look at what is allowed, there are secular exemptions allowed.
Of course. Yeah.
Like federal law for, the special needs IEP.
Right.
But if the child's over 18, so a senior transferring to California state schools who's 18 would not need to be vaccinated. I'm just kind of random exemptions, but not for religious beliefs or
Correct.
reasons.
And this is furthers the support of the argument that it can't work. There are people who are exempt. These petri dishes cannot remain sterile. It's just not possible. And there are people who can get exemptions, and they're still participating in the same classrooms and programs as these other children. The system cannot work the way that it is intended. So these poor people who want to do something different are just victimized as a result of it.
Yeah, and then those kids who have to stay home during the school day, then they're in the same extracurricular activities, right? They
Correct. Yeah.
get the same, theme parks and
Correct. It can't work.
Yeah.
It's a concept that's broken. This is why it relies on the fear to drive it.
And adults within the schools are not under.
Of course, do they make sure that every volunteer that walks into the classroom is fully vaccinated? I know they get background checks now and little ID tags that say I'm a parent volunteering on campus, but they sure don't get their vaccine history done, do they? So again, this is just an experiment that's gone awry. It cannot work the way that it was intended to.
If we could go back to informed consent, as a doctor, what is the definition of informed consent and what does that entail?
Well, my job in providing informed consent for my patients is to say, here's the procedure that I'm recommending. These are the benefits that I expect you'll receive. These are the risks that go along with undergoing the procedure. It just has to be very clear and cut so that everybody knows what they're getting into. Now, in my office, we are doing spinal manipulation. We're adjusting the spine. We're moving bones, whether it's in the structure of the spine, extremity joints, even the structure of the cranium. We're working with physical anatomy. And so it's very important that we have that talk with our patients. What can you expect? This is exactly what we're going to do when we put our hands on you. Remember that most medical doctors don't put hands on patients anymore. It's all about writing prescriptions. So we're in a very intimate position with our patients. They need to understand exactly what we're going to be doing, how we're doing it, why we're doing it, what are the risks, what are the benefits. It's informed consent. And it's something that every patient deserves, no matter what procedure they're undergoing, whether it's a chiropractic adjustment or getting your teeth cleaned or getting a prescription written for you. In fact, I hear more of education that happens at the pharmacy level. Doctors write the prescription for the patient. The patient shows up at the pharmacy to get that prescription filled, and it's the pharmacist who starts saying, here's what you might need to know about this medication. I'm going to give you some informed consent before you take it. And for many of these patients, it's the first time they've heard that there's a risk with this medication, or they shouldn't take it with alcohol, or that they shouldn't take it during the daytime and operate a vehicle. They're like, oh, wow, I didn't know that. Well, you didn't get informed consent from your practitioner. This is the problem,
You talked about these papers. You had a special name for it, right? Are they
papers?
Studies? Are they
the studies? Comparison studies, yes.
Comparison studies. Are they randomized control trials or?
They are retrospective studies. So they look back at patient records. So having a randomized double placebo-controlled study would mean we're going to take a group of children and we're going to vaccinate some of them, and we're not going to vaccinate some others. and the patients are blinded, and the doctors who administer the shots are also blinded. That's a double blind placebo controlled trial. That's never been done. It will never be done, sadly, because we know the results before the study's ever done. Look, these retrospective studies where we look back at the of children's healthcare records are already telling the story. So they'll never do the double blind placebo controlled study because in their mind they say we can't deprive a child of a procedure that would benefit them. So they would never say here's a placebo procedure. That's why the study won't be done, because they will always justify in their mind that they would be withholding a benefit from a child, and there's no way that they would be able to do that. And that's why they haven't done it yet.
So if we could go deeper into these retrospective studies that have been done, could you say more about where they've been published and what the scope of the study?
Oh, sure. One of my favorite, Dr. Paul Thomas, I believe, is a pediatrician who was practicing in Oregon. And he was a medical doctor, a pediatrician. And he was concerned about the number of challenges he was seeing within the vaccine schedule. And so he did his own study within his own practice. He went back through his 13, 14, 15 years worth of records and compiled the study we're talking about. And the day that he published it, the next day, he was labeled by the state of Oregon as a risk to public health, and he had his license taken away to practice because this information was so powerful. It showed in crystal clear data with charts and graphs and everything how the children that had received more shots were at higher risk for any number of various conditions, and those that received fewer or none had a much lower risk. And this was just information that the state of Oregon did not want to get out. It was published and it was shared, and it sadly ended up in this Dr. Thomas having his license removed. But he's not the only one who's standing up for this. There are numerous medical doctors now who are providing the information, writing books. I provide a list of information for my families that help to provide that educational stuff, and many, many books written by medical doctors on this subject, and not brand new. I mean, for decades, it's medical doctors who have been sounding the alarm, but they're ostracized by their own colleagues as a result of their going against the status quo.
If there's something that you would want people to know about this issue, what would be the most important thing, do you think, that you would want to communicate about it?
I think the most important thing is that everybody needs to recognize that they have got to take responsibility for their own health care. There's no excuse when we have the internet and all of the information available. There's no excuse for somebody to not know what they're getting into, whether they're going to get a chiropractic adjustment or they're going for a prescription for a UTI. I mean, everybody can ask their computer to tell them what to expect. It's just, you have to be your own advocate for your healthcare needs. You need to take responsibility for being educated about what your condition is, what the treatment options are. And if your physician isn't providing you that information, then you need to find another physician. I just can't highly recommend enough getting multiple opinions. When we're talking about surgical procedures, especially, you need to have multiple opinions. If we're talking about a medical protocol for pharmaceuticals that's going to be undertaken, you need to have multiple consultations, get multiple opinions, but you have to take responsibility for your own health care. It's the days of going to the family doctor who's known you since you were a baby and trusting everything they have to say because they know you intimately and have known you for 25 years is over. When you sit in front of a physician, it's probably the first time that you've met them, and it's probably the last time that you'll see them, because next time you go, you're going to see somebody else. This is the nature of the system these days. Sadly, it's not an intimate relationship any longer. So I sadly have to tell my patients, you have got to take responsibility for yourself. You have got to be your own advocate. And so that's the message that I want to share with families is do the time, the effort to educate yourself, no matter what healthcare decision we're making, whether it's a vaccine or getting a chiropractic adjustment. Make sure that you know what you're getting into. Be responsible for that. It's up to you to make that choice, not somebody else to make it for you.
That's great advice. Have you always been like this, or can you tell us what your journey is?
Yeah, I guess I've always been like this. You know, as a chiropractor, our way of thinking is just different. It's interesting. I try to train my staff as they come on board to let them know what chiropractic philosophy is. Many of our front desk girls have been patients or have been to chiropractors before, but some have not. And so we need to do some educating. And the important concept is this: you have to recognize that 150 years ago, when we were all trying to figure out the basic ideas and concepts of what we call science, there was a division. And one group went in the direction of what we call vitalism, the other went in the direction of what was called mechanism. And vitalism simply states that we have this God given gift. There's this innate energy, this drive within this organism to thrive. And mechanism sees it differently. It's just a group of cells, and it does what we expect it to do because we have the science that shows what it will do. And there is no mechanism that drives it, it just is running. And so my philosophy has always been, if there's dysfunction in the system, we need to look at the roadblocks in the way, remove the roadblock, and then that innate knowledge that the individual carries with them will be able to be expressed and get them to their goal of health and wellness. We just have to remove the roadblocks. Whereas mechanism looks at the whole system and says, well, it's breaking down, the chemistry is not right, it needs this chemistry to be added to change the chemistry to get it to the right point. And so everything is about adding medicines in an effort to change the symptom set or make things look good from a chemistry standpoint. The labs are in the normal range because we now have this medicine in the mix, but it doesn't take into a mix the vital gift, the ability of the body to actually work the way that it was intended to. So it's this huge divide that takes place 150 plus years ago in philosophy. And when you recognize that the body is organic and has this ability to heal itself, and it is indeed a vital force that we can harness and support, or that we can crush, then you recognize that there's a gift here. When you see the body as nothing but a machine that you can tinker with and just add medicines to get the desired outcomes, and there's no underlying drive or force within it, then you miss out on so much that life has to offer, I think. So yes, the answer to your question, that's how I've always felt and believed this. Yes, life is a gift. It is an incredible gift from our Creator, and we need to harness that, recognize that, and simply look to remove the roadblocks that impair that gift from being expressed. It's a different view of healthcare altogether.
Yes. And would you say it's kind of a faith-based view that you have?
Oh, absolutely.
I think it's interesting when California got rid of their religious exemption, they got rid of the personal belief exemption, and everything was encapsulated into one.
Correct.
There is never a study of, what's the difference in numbers between the personal belief exemption and the religious exemption. And I'm curious if you hear kind of both camps in your practice, and I'm wondering why they never conducted a study.
Yeah, good question. I happen to live in Riverside County, the southwest corner of Riverside County. We call it the Bible Belt of Southern California. The vast majority of my patients, they don't want this stuff because they believe in pretty much what I just said, that they have a God-given gift, and that body needs to be able to express that gift. I have very few patients that come to me and say, I believe I'm a secular mindset, and I believe that, nobody should be able to tell me what to do, and it's my philosophy. And I believe that everybody should have that position, but I very rarely ever hear somebody standing on their philosophical beliefs. The vast majority of the families that I serve, it is religious-based. But I'll tell you, Aaron, it infuriates me even more when these obviously religious-based families may be putting their child into a religious school, whether it's a private school or a charter school where the tenets of the Christian faith are being taught. These same administrators are telling families, you have to get these shots in order to attend this faith-based school. And oh, by the way, we recognize that some of these live virus vaccines may have aborted fetal cell lines in them, but too bad. That just blows my mind. We saw through COVID how many faith leaders did not have the ability to stand up and tell the state no. And this is what infuriates me, is that these faith-based schools do not stand up to the state and say, not on my watch. You will not force us to force our congregants, our children to undergo this procedure when we know that aborted fetal cells are being utilized. I don't understand how anybody who calls themselves a pastor who participates in a program like this would force families to undergo this procedure in order to attend their faith-based school. These are the people who should be leading the charge. Religious leaders should be banging the drum and saying, not on my watch. But so many of them are just falling into compliance, and that just makes it hard to be a Christian this day and age. These families, these leaders need to stand up.
Could you educate us on the aborted fetal cell lines and the science behind that and how that is connected with these vaccinations?
Well, sadly, these viruses, these bacteria, these organisms, they need to be grown in certain mediums, and these mediums go back to high school biology. You know what a petri dish looks like. You take the cap off, you smear a little something on it, and then you set it aside with the cap on in a warm spot, and it grows stuff, right? So we have to grow these organisms in certain medium, and this is the challenge: is we use these various cells, these tissues that have been obtained from various sources, whether they're aborted fetuses or animal cells, monkeys, chickens. These cell lines are just utilized in the process of manufacturing and testing the vaccines. And that means that the DNA from that organism that was a part of the test is incorporated into the shot itself. So there's no way to keep these products clean. They are always going to be contaminated by the things that they are working with, that they're raised with, that they're tested with. And so this is the problem, is that we can't separate the two. If you have a belief that abortion is wrong, then deriving cells from that aborted fetus and utilizing them in a procedure that's going to be introduced into my child is abhorrent. I just don't understand how anybody who is a faith-based person who stands against abortion would allow something like that to occur for their child. And especially, as I said, these pastors who are leading these schools and congregations, they should be putting a foot down and saying, not on my watch, but yet they're not.
So remnants of these human diploid cells are in the vaccinations? Is that like when
Yes.
they're moved to the child?
Yes. The DNA is incorporated, the actual cell lines that are derived and reproduced are then incorporated. And so, yes, your child is receiving cells that were derived from or originated from a aborted fetus. And that is crossing a line for many people. But again, informed consent isn't taking place. And many people don't even recognize that that's part of the deal that they're signing.
Which vaccinations use those cell lines?
There's a number of them. Off the top of my head, I don't want to try to give you the list if I'm incorrect, but the live virus feed lines are the ones that are primarily affected.
And do you think that recognition of the use of aborted fetal cell lines is something that mostly became popular knowledge during the creation of the COVID vaccine?
No, this is something that everybody's been well aware of for quite a while. Again, it's just hush hush. If families knew, I swear, if any mother knew how the shot that was created, that the rabies being given was created, there's no way. I mean, you think about how we have safety laws. You can't put this diaper onto a baby's butt without knowing what chemicals are in it. And, this one's unsafe because it's going to irritate their skin. If mothers knew what was in these shots, I mean, think about it. You're putting these chemicals into a blender, you're hitting zap, then you're pulling it up into a syringe, and you're directing it directly into your baby's bloodstream. If mothers knew what was in that shot, not that it protected their child, that's not what they need to know. If they knew what was in that shot, they would never allow it into their child's body. And sadly, every mother, even those that sign up for every shot on the schedule, there's a check in their spirit. They know their baby is going to cry, and they know that I don't want to do this for my baby, yet I have to. Becomes this overriding drive, But there's a check in every mom's spirit. They don't want their baby to cry as a result of being injected by a needle. Every single one of them knows that there's something that's not right about that, and yet they're forced to do it anyway.
What do you think is going to happen, do you think, in the Ninth Circuit with these judges? And I know that you're a doctor, and
yeah, it's not my job to be an attorney. I can only hope for the best. That's all I can say is the Ninth Circuit is not one that's generally kind to the types of causes that we're needing support up here. So I will just have to see how it goes. But it's your job to present this information in a manner that takes it home. These people need to understand that it's not uh, this concept of public health. It just doesn't work. And that's the thing we got to try to convey, is that you can have these grand ideas of keeping everybody safe from diseases, and that would all be wonderful if it worked, but it simply can't work. And it clearly doesn't work. So why do we continue to force this high degree of risk when it just doesn't work? And this is the reality. Again, if it worked, we'd be having a different conversation. If vaccines were effective and were safe, we'd be having a different conversation. You just cannot force these things on people, because where there is a risk, there must be a choice.
If you were sitting on the panel and you could ask one question to the attorneys arguing the case, what would you ask?
If you had a baby as of 6 months old and you were sitting in front of a doctor and you were told that you missed your last 3 shot visits, and that today at your 6-month visit, your child was going to be given 6 vaccines in one visit, what would you say to that? Yes or no? When at that visit, they were supposed to get 2, but because they missed the last 3, today they're going to get 6. How do you feel about that?
And you see that happen, I'm sure.
All the time. All the time. And that's when the exponential risk just keeps going up. Every shot comes with some degree of risk. When we layer 1, 2, 3, 4, 5, 6 at one time, the risk is exponentially increased. And I think that everybody knows that. That's why I think if you ask somebody who's staunchly pro-vaccine, if you were supposed to get 2 today and they said you need 6 today, would you just say, okay, or would you have some degree of second thought about that?
And in order to go to school in California, you have to be up to date. So they can compound all of the...
If a child is not up to date and that school starts next week, you may have a proposal from a vaccine, from a pediatrician that says, we're going to get them current. We're going to give them 6 or 7 shots today to get them current, and then they can attend school next week. That's a high degree of risk. And I don't think that any parent would want to receive 6 or 7 vaccines on any one given date. So why would you want to do it for your child?
Thank you so much for being our guest. And I appreciated this conversation so much. Any last thoughts before we wrap up here?
Oh, gosh, I just really, I'm eager to see, as I said, the day where we can look back on this as foolishness. I want families to embrace this God-given gift of health, this ability to overcome the challenges that we experience in our day-to-day needs. We're going to get sick. We're going to have toxic burdens. We're going to have injuries. But how do we manage these things? That's the biggest question to answer. And my job as a chiropractor has always been to give the better answer to those questions. And so I would always just encourage families to stay strong, have faith that your body is a gift. It has an innate wisdom. It can overcome these challenges. You just need to learn how to support that. And sadly, your medical doctor won't support that at all because they don't recognize it. The underlying philosophy, again, mechanism doesn't recognize that gift. So you need to find practitioners that resonate with that. People that, whether it's a chiropractor, an osteopath, there are a few still of osteopaths who have a better understanding of this gift, naturopathic physicians. There are a number of healthcare providers that think this way. So I think it's time for our, again, patients to take that responsibility upon themselves and find practitioners that work and feel and think the way that they do. And that's how our practice has grown. I mean, we've been blessed to serve so many families, and it's referral based. People don't generally come to us that don't know who we are, what we stand for, what we do. They're referred by friends and family because they are told this is what you can expect, and this is the kind of place where your choices are going to be respected. You're going to have your bodily autonomy respected, and they're going to help you towards your goal of health and wellness. They're not just going to say, here's the next way to manage your symptoms. I would just want everybody to understand that that is something that's available. That gift of health and wellness is there for everybody. You just have to find the practitioner that's going to help you get there.
Wonderful. Doctor, thank you so much. Thank you for being such a great friend to Advocates for Faith and Freedom. And I've thoroughly enjoyed having this conversation with you.
Well, thank you, Aaron. Let Bob know that I missed him, but I wish you guys the very best. I know that he has been working hard on this case, and it's a pleasure to meet you and get to see you face to face. And I know you're working hard, so go get him, girl. Okay.
I will.